Hi guys, it's Dr. Lisa Smith here from Errol Street Chiropractic in North Melbourne. And if you've got neck pain or back pain, lower back pain, and you've got arthritis, then I am going to go through something that's going to blow your mind, because most of you have been told that arthritis has got a lot to do with your age. It's all about aging. Well, let me tell you, it has nothing to do with how old you are, because we've got people in their 20s with arthritis. We see it on a daily basis in our office. So we're going to go through what is the real cause of that arthritis, what can it mean, why it came about in the first place, and what you can do to help to slow down and maybe even stop that progression of that arthritis. So there is something that you can do about it. So stick around and we'll go through that in a moment. Now, why am I holding this shoe, you're asking? Well, just humor me for a moment. Now imagine you're walking around in your shoes, and on one side you actually are walking out around on the outside of that shoe. Now do that for a couple of hours, no big deal. Those shoes will be fine. Now imagine you're walking around, instead of nice and flat, but you're walking around the outside of that shoe for a week, 2 weeks, 3 weeks. What's going to happen to your shoe? It's going to start to wear away on that outside part. So this is giving you a clue, guys, of why your spine is wearing away. Okay, now what we're going to find is that, well, you know that if you've got arthritis in one part of your neck, that the rest of the neck joints are looking and discs are looking okay, well then you know already it's got nothing to do with age, because the spine is all the same age. So there goes that theory. So one of the reasons why is, as we've spoken about, is a spine that's out of alignment. So if your spine should be sitting one way and it's sitting and it's stuck in another way, you're just going to wear away. And it is a progressive condition. It does not happen overnight, people. It's like a hole in your tooth. It doesn't happen overnight. It's not a normal thing. It's like saying, cancer happens more in the elderly, in the older population, and it's normal. It's not normal. It happens often because people aren't looking after their spine. So I kind of get a little bit annoyed about this daily, because I'm hearing it a lot. So out of alignment, we're going to start to wear away. So imagine that spine that should be nice and straight, and it's sitting in a bent position. We've got uneven loading there, so it's just making more and more sense. Now, the other reason why that spine will degenerate, now we're talking about not people with metabolic issues or kind of some strange reasons why, but most of the population, this is who we're talking to. Now, the other reason is when the spine is not moving properly, so a lack of spinal function. Those joints should be moving beautifully. If they're stuck, the research is showing more and more. Okay, it was an article in the Orthopedic Journal of Surgery that a lack of spinal function increases your likelihood of degeneration. Okay, we've been saying this all along, people. So what can that degeneration in the spine feel like? So, a lot of the time it can feel like stiffness. When the spine is wearing, and I'll show you what that looks like. When the spine is wearing, we have spurs that are sticking out, if you can see that. We've got narrowing of the actual discs. That's going to start to put pressure on nerves. So we're going to have soft tissue pain, we're going to have nerve pain perhaps, we're going to have joint pain because it's going to start to compress the joints. There's lots of areas where that pain can come from when that degeneration starts to progress. But we are actually getting changes in how people are feeling even when they've got degeneration in their spine with our chirobiophysics. So we know now why your spine is degenerating. We know what it can be, what sort of symptoms it can be leading to, but and the other thing is, what are we going to do about it? Can we actually stop this progression? Now, we can't reverse degeneration, okay? So we can't do that, but we can actually stop it. Because if you leave those forces there, then you're just going to keep wearing away. If we start to improve that alignment and get that spine moving better, we're taking away those negative tensile stresses, and your spine is going to start to slow that degeneration and stop it. And this is where chiropractic fits in beautifully, because no one really talks about this and it's not really known about. So I'm here to tell you guys about it, because I kind of get a bit annoyed about it because not enough people are speaking about it. So anyway, if you are sick of that spine hurting and have been told that your arthritis is due to age, and you are wanting to do something about it, then come in and get your spines checked Our chirobiophysics work that we do in the office is a spinal rehab program that really helps to improve that spinal alignment like no other technique in chiropractic in the world. So it is pretty amazing. We're getting really great results. So just give us a buzz, or if you've got any questions, just call, email us, message below, and we'll love to chat and help you guys out. All right, guys, take care. Bye then.